Hello, my name is Tiffany Atkinson. I'm a recreation therapist with the Duke Cancer Patient Support Program. And today I wanted to tell you a little bit about what oncology recreation therapy is. So oncology recreation therapy, the purpose is to assist adults with cancer and their families in adjusting to their illness, treatment, and hospitalization. So this is done by providing one-on-one recreation therapy treatment sessions facilitated by myself, a licensed recreation therapist, along with providing general recreational activities and resources to assist patients and their families in maintaining and/or improving their functioning and well-being in the physical, social, emotional, cognitive, and leisure domains. The reasons why a patient may work with oncology recreation therapy while they're in the hospital is because they may be in the hospital for a prolonged length of stay. They may have difficulty coping with their illness or hospitalization or going through treatment at the hospital. They may need to maintain their physical functioning, especially during those long length of stays. They may need to learn to develop additional strategies for stress management, maybe be providing procedural support while they're in the hospital. They may need to learn different ways to address fatigue and decrease endurance. Maybe have support from the body image concerns, improving self-esteem and self-image. Learn new ways to cope with anxiety or fear related to the illness or hospitalization, as well as a need to develop additional strategies for pain management. So a lot of these are reasons why patients will get referred to recreation therapy services. And once I get a referral for a patient, then I'll just complete a standardized assessment on the different areas of domain, the physical, social, emotional, cognitive, and rec leisure areas to identify an area of need. And after that, there's a treatment plan is created with the patient. So based on that area, identified area of need, and matching that with the patient's recreation, leisure, activities of interest, and what hobbies and what things are important to them. So just to give you a few examples of what rec therapy will look like, and some things that we can focus on together to help improve your overall quality of life during your hospitalization, maybe the focus might be on low impact physical functioning. So here you have a picture where we're playing the Nintendo Wii. So we're using that to stay active and have fun while they're in the hospital. Wii Sports, the Wii Fit. We also have cornhole. We have a putt-putt and do a walking program, all to address physical functioning. Maybe the focus might be on coping strategies, so utilizing expressive arts or maybe journaling. Maybe physical exercise is a positive coping strategy for you. Maybe learning relaxation techniques, connecting with peers, self-image. So again, like focusing on what that area of need is and what's helpful for each person in coping. Another focus for rec therapy could be on relaxation techniques. So learning how to cope with stress and anxiety and manage that through maybe guided imagery, progressive muscle relaxation, deep breathing, different relaxation techniques, and more of a holistic approach to coping with anxiety while you're in the hospital. Self-image is also very important. It's something that I focus on with folks, and I'll take people from the hospital over to the cancer center to participate in the self-image services that they have over in the boutique, so such as getting fitted for wigs or learning how to tie headscarves, salon services, things like that. So just making sure that folks know that those services exist and that we can still participate in those services even while you're in the hospital. And continuing on, different interventions that rec therapy can facilitate and what you can participate in during your hospital stay. Maybe the focus might be on concentration and improving your cognitive abilities. So by using recreation activities such as cornhole or crafts or board games, puzzles, things that are activating your thought process and sequencing and memory recall, so things like that, to using those fun activities to focus on the improved concentration and memory recall and your overall cognitive ability, but doing it in more of a fun way. of course. Leisure education is another aspect where, especially if you're in the hospital for such a long stay, like learning how to structure your time and improve quality of life and engage in activities that are interesting and enjoyable for you while you're in the hospital. So such as maybe learning arts and crafts. I teach a lot of patients how to knit, doing something fun maybe you haven't tried before, like the Nintendo Wii or putt-putt or expressive arts or journaling. So taking the time while you're in the hospital to learn something new and try something new and improve that quality of life during hospitalization. Another focus could be on socialization and self-expression. So we do a lot of groups and activities like holiday parties, karaoke, we'll have cornhole tournaments, play the Nintendo Wii together as a group, or we do craft group on a weekly basis as well. And then another focus may be on legacy building. So providing that opportunity to create memories and keepsakes and share those with your loved ones. So such as a recordable storybook, which you see here in the picture. So recording your voice on a children's book, and that way when it's sent home to the young ones in your life, you know, they are able to hear your voice reading a book right to you. Other aspects of legacy building might be doing hand molds, handprints, living history, which is a life story. So sharing who you are as a person on a written format. So where you're from, what you do, your career, your family, things are important to you, and typing that up into a story format. Then we also have voice recorders and scrapbooks, and really it's figuring out what's important to each person and providing the opportunity to create what that is that's important to them to be able to share with their loved ones. And here are a few other photos of some pictures from fun things that we've been doing here in the hospital. Like you'll see on the far right, we have from our Halloween party last year, and on the far left, you'll see me teaching someone to knit, to learn to make their own hat. And then here in the center is just a visual of different resources that I also provide to patients for them to do independently to help structure their time while they're in the hospital. So maybe you're renting a movie to, you know, watch on their TV in their rooms, or a journal, or a guitar, keyboard, word searches, deck of cards. And we have a lot of resources that patients are able to utilize independently and with their family when their family comes to visit, to help structure their time and improve that quality of life during hospitalization. And just another component of recreation therapy is our volunteers. We have a lot of volunteers within our program to help facilitate pet therapy. We do the pet therapy visits with our patients up here in our inpatient oncology unit. We have the hospitality cart, so the refreshment and snack cart, and it also has different resources on there available for folks. Our living history program, where our volunteers sit down and interview a patient and create that life story to share with their family. And then we have our arts and craft group that our patients and family members are invited to on a weekly basis, and we have volunteers who also help with that program as well. So just so you can kind of get a full picture of what recreation therapy is, not just from the one-on-one treatment aspect, but also our volunteers that really help our program as well. So I want to thank you for your time today, and if you're interested in receiving recreation therapy services during your inpatient hospitalization, please inform your oncology provider, or you can call the Oncology Recreation Therapy Office at 919-681-2928. Thank you.